the World Health Organization says light is at the end of the tunnel for the UK. But officials here are quite cautious, in part because of the number of unvaccinated people, estimated to be around 5 million. Now, in the first of two special reports, my colleague Clive Myrie, cameraman David McElveen and producer Sam Baranti have returned to the Royal London Hospital to talk to staff and patients there.
At the Royal London Hospital, a multi-bed intensive care unit sits abandoned and silent. The worst has passed in this pandemic, but is it over?
So this ward down here, all the way along there, full of patients this time last year. Correct, one of 8 wards that we ran at the time.
Now there's just one ward with 6 patients.
Those who are vaccinated.
Consultant Nick Bunker, who worked through the darkest times, points out what unites 5 of them.
Unvaccinated, 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 unvaccinated and unvaccinated. Does it make you angry? I think it's mixed emotions. COVID isn't universally the only disease where people make poor decisions. Right. But it's resources that we're using to treat people we don't have to.
So big breath in, tight seal, and cough. Good.
COVID vaccines have now allowed many millions to breathe easy in the pandemic, relieving pressure on the NHS. But Gonan Haimes, a once healthy 58-year-old, chose another path that nearly killed him.
I was close to death.
So why did you not take the vaccine?
Fear of the unknown.
Fear of the unknown. So you were just worried about this thing being put in your arm?
Uncertainty. Better take the vaccine.
Better take the vaccine.
I think so.
Asif Hussain would have had no qualms about getting a jab. Still in his 20s, he's on his feet now, just about. We last saw him in hospital a year ago, infected before the vaccine rollout. We didn't think we'd ever see him again. What did you think when you saw the video of you intubated, asleep at the Royal London? What was that like when you saw it? What did you think?
It was unbelievable. I had to watch it back a few times just for it to register in my head. No, that's you asleep, that's you limp laying there. So it was shocking, and it did take a while for it to register in my head. You know what, this is what you have been through.
The rest of society is moving on. We've got to live with this thing now. No suggestion that there's going to be another lockdown, potentially.
Yeah.
But is there a sense, because of the long COVID, that you will always be blighted by this thing?
Of course. I haven't been able to go back to work. So I was a gas engineer by trade, so, you know, a very physical job. With my condition at the moment, I don't think I'll be going back to work, that type of physical work, anytime soon, yeah. I remember my wife telling me they called her and they told her and mum to come and say their goodbyes to me. And I can't imagine how difficult it must have been for them, you know. But, you know, it's all thanks to God I've made it through.
The pandemic has forced much self-examination. What are our thresholds for lockdowns and mandates and COVID rules? We all looked within, appraising our own capacity to cope, and the NHS has had to do the same, scanning forensically and examining its practices and procedures. And one of the biggest questions is whether COVID vaccinations should be mandatory for staff. The government says yes.
Actually, yeah, please, because it's fairly urgent.
But consultant Mari Healy,
Still coming, go, go, go.
who helped lead NHS troops at the Royal London in the battle against COVID, thinks differently.
I think the difficulty with the mandatory vaccination is we're going to lose staff, and I think we can't afford to.
Do you know staff who've made it clear that they're going to leave?
Yes, definitely. I believe that to be true, and we have already lost some.
It's a bit of a numbers game, isn't it, tonight?
Staffing pressures made worse by the highly infectious Omicron variant.
I'm 6 nurses down. I have no one.
Fears over rising cases after Plan B restrictions are lifted, and longer-term, ever-growing waiting lists all mean tough times ahead.
Ready, break, flip.
So, make no mistake, the worst of the COVID pandemic may be over, with fewer patients needing the most intensive care.
You should feel it coming out, but it won't be painful. Okay? And then after that,
But the pressure is still on the NHS in so many other ways. Today, 48 hours after we first met Gonan, he's having his artificial airway removed. He'd spent over a month on a ventilator.
I can breathe. It's a miracle.
It's a miracle. COVID didn't beat him. Can the NHS say the same?
I'm alive.
Clive Myrie, BBC News.